before we start the meeting, let's go with a round of introductions. Let's start the introductions with the person who's present on the phone. Alan, are you there?
Can you hear me?
Yeah, could you introduce yourself? And we are just doing a round of introductions.
Yes, thanks. Thanks, Arvinder. My name's Alan Flood. I work for the Lapine Community Health Center. I'm a grant writer and a program developer, and look forward to hearing from everybody.
So thank you. I'm Arvinder Singh. I'm the CHIP coordinator at Lake Hill District. And you can go either way.
I'm Andrea Wishart with the Lake County Senior Center.
Rochelle Hansen, Food Corps.
Alana Shamiak with the Eastern Oregon Healthy Living Alliance.
Francie Winters, Lake Health District Prevention.
Noni Moss, Senior Navigator at the Senior Center.
Jamie Davis, Oregon State University Extension Service.
Larry Coulter, Administrative Training for Lakeview Gardens.
Sheree Morgan, Social Services, Lakeview Gardens, and board member of Senior Center.
Beth Hadley, Public Health.
Paul McGinnis, Greater Oregon Behavioral Health and the Eastern Oregon Coordinated Care Organization.
I'll introduce myself, plan to come to the table, I'm Darrell Johnson. County Planning Director, also Town Council.
Jimmy Hall, Lake County Examiner.
Thank you. We'll take a minute to go through the November minutes. So do we have a first approval? Do we have a second?
I'll second.
Do we have somebody who wants to make a comment against it? Well, the minutes are approved. We'll start the CHIP meeting with regional housing assessment discussion by Mr. Paul McGinnis.
Thank you, Arvinder. If you look on the materials there, this is just a brief report asking if there are people who are interested in helping fill out a simple document regarding housing in Lake County. I think we need to have some representation maybe from Mr. Flood or somebody up north looking at the two different markets. We are anticipating that depending on what happens with the Oregon Medicaid waiver, given the change in the administration, if we get the waiver that we want, the coordinated care organizations will be involved in housing. We're already involved in housing, as Dan Schwantz shared with the group when he talked about transportation here in Lake County, with rental assistance for people who have severe and persistent mental illness. But this is more generalized to low-income folks, disabled individuals, children, homeless people. There's no real right answers, but we're just trying to gather up the information and was wondering if there were anybody on the group that had a Mr. City first.
So, Oregon State University handles the population forecast that all counties can adopt.
Right.
And so they recently did ours about a year ago. We haven't actually adopted it. I'm not sure how many counties have adopted what they put together so far, but it's available for us to use. And so that information would probably be very helpful to this group and to, along these lines possibly. Just kind of gives a analysis of what all is out there for housing, how many units and all this kind of stuff. It probably doesn't talk too much about the market, available housing, especially for low income.
Right, I mean, some of the things that we're looking for here, I think they can get the information that's out there, it's local knowledge that really is gonna have a play. If there were some sort of a housing unit being, constructed now, there would be an opportunity, for instance, to maybe try to buy a few units and set them aside, that kind of stuff. So, don't know if we have the right folks to fill this out, but would certainly.
I'll take a closer look at it.
That's what it is, and our vendor, you'll hear from Dan at the meeting on Monday.
Yeah.
And Ken, I don't know if you've RSVP'd yet for Boardman on Monday? Okay, so there'll be more details, but I just wanted to, we were asked to introduce this to the CACs, and I've done that. Yeah. Important housing, transportation, food security, all social determinants of health. So that's the reason for it.
So thank you, Paul.
You bet.
Let's get into the CHIP updates. We'll start with the oral health update. So the dental screening program, the dental screening program has been completed. I think it got completed sometime this week. And we are still to receive the numbers for the children screened in Adel and Flush. For the North Lake, our numbers are 44 children screened, and for Paisley it is 15 children screened. And for Lakeview, I did a kind of a comparison between the children screened last year compared to how many were screened this year. And the ADA Fremont School is where we get a majority of children that get screened in the dental screening program. So last year we screened 196 children in ADA Fremont, and this year we ended up screening 26. So that's a big dip in the number. And I have a meeting with the school district officials where we are going to discuss about, sorry, didn't mean to interrupt. Discuss about how we want to change the method of carrying out the screenings in future, so the numbers go up. And well, it totally depends on how the meeting goes. My goal is to, for 2017, that we have an earlier dental screening session. My goal is that we can do it in early spring next year. And but yeah, I'll keep all the members posted about how the meeting goes and what we can do to improve the numbers in the future.
Are we talking about another round of screening sometime this year, or vendor?
This year?
Yeah. I believe we were looking down the road maybe towards parent-teacher conferences in the spring.
Yeah, spring, yeah, that's what I meant, I'm sorry, yeah, this year, yeah.
Okay. Perhaps to get the word out, we can capture a lot of them there as well, so.
Yeah, and because earlier I guess there wasn't a coordinator present, and I guess there was a mishap with coordinating and reminding the parents, and so this time I'll take the responsibility.
Yeah, because it worked pretty hard to get Mindy there at parent registration and everything, and
yeah.
If something was lost somewhere in the communication between the parent registration and parent-teacher conference night, so it'll be worth, having a good discussion on that when we meet and see what we can do to increase those numbers.
Absolutely, because this year we didn't do too bad on the consent forms that were returned. The parents signed the consent forms. We got close to 180 consent forms, but I guess there's a lack of coordination because even though we got their permission, they did not end up showing up for the parent-teacher conference. So yeah.
Sounds like there's a communication gap there someplace. So.
Yeah. I hope I can
so let's
fill the gap. Yeah.
Let's work together on it, see if we can, really increase that. So.
Yeah.
So it wasn't that you didn't have consent forms signed, it was that they just weren't there at parent-teacher conferences to actually get screened, is that, okay?
Yes. So, anybody has any other comments? So going to the Women's Health Ambassador program, the last Women's Health Ambassador class had taken place in November, and the program is complete. As of now, I'm working on preparing a report about how the program turned out, and also if I can develop a system of whether the program brought about any lifestyle changes to all its attendees. And yeah, so I'm working on that. I'll keep you posted. Anything you wanna add, Noni?
Well, I know, like with mine, the ladies that were going to attend mine actually ended up going to someone else's, which was great, because she had kind of a big thing going on, and, you know, and had people online as well. Everybody kind of clued in. She did that was Anna, she did a really good job of bringing that full circle around. But she and I actually were just chatting about it, and the connections, maybe not so many lifestyle changes as I can't think of the word.
Support group,
Yeah, more of the base that they have now, the connections that these ladies have made. There's, I think she and I counted, there were 6 that up to this point, they go to church and they go home. They don't, you know, they don't socialize outside of that. They go to the grocery store by themselves quietly. And now they have this group that they're getting together, this whole group of people, that they're kind of taking care of each other. There's 3 of them that all go to the grocery store together now. And because one of them can't walk for too long and, you know, reach up the high shelf, so they've kind of created their own subgroup. They now meet every day for breakfast.
Nice.
So, you know, they go to each other's houses, but they meet every day for breakfast. So, that has been a good, you know, that's been a benefit of that. So, and kind of a lifestyle change for them, but more so just that support.
Social.
Yeah.
We need to get into strong people.
Yeah. But, so it has been, there has been a lot of beneficial aspects to it. Just, you know, getting them out more, ladies that wouldn't have gone to, you know, a meeting per se to go and sit and talk about their health. But I think the way the class was structured in some of the groups, it was not a class that you go and sit and listen, you know, you're involved, it's participatory for everybody involved. And I think that was the biggest benefit of the whole thing.
Yeah. Well, that's very good you have a story of that, because Anna was present in the last meeting, if I'm not mistaken, and she has many of these stories where people met, and you know, if we can phrase it as a lifestyle change, but it's making their life better definitely. So yeah, I'm gonna ask all the Women's Health ambassadors to share their stories with me, and yeah, and I'll also look if we can sustain this program. Definitely, if you want to sustain it, we can't have the 9 ambassadors. I guess we'll go with 4 or 5. But yeah, I'm preparing the report and keep everyone posted. Coming to the Youth Health Advocates, so the Youth Health Advocate program is a joint venture between Lake Hill District and the CHIP Department and the Oregon State University Extension Office. And so Jamie, is there anything you can add?
Sure, well, I think since we held our training, which we trained, we recruited, screened, and trained 8 youth health advisors or advocates throughout the county. So we have 4 in Lakeview and 4 from North Lake. In August, we held a training at the hospital to provide youth with the content they would be teaching, but also then equip them with some teaching skills. They each have an advisor that's in a local, so in Lakeview, and another advisor in North Lake, and a job advisor to help them teach these classes. The goal was to teach, get into the schools and teach their peers health-related lessons that have a local, or based on our local data needs. And 4 lessons and ending in December was our goal, but with the transition from Mira to saying we're a little off schedule, and we're hoping to close the program before the end of the school semester. So they've taught in both Lakeview and North Lake 2 of the 4 lessons right now. The ultimate goal is to assist youth not only gain skills and to determine between health myth and fact, because there's a lot of different things on social media, and other things to help them equip to go into adulthood, but then also to understand the importance of them connecting with a healthcare provider through well child checks, because we have such a low rate here. Singh has shared that we haven't really noticed, even though due to incentives, increased well care visits, but hopefully through a program evaluation that we'll conduct at the end, we can see what were the barriers for youth to get to go in and see their healthcare provider for those appointments. So I'll just pass around, it's a photocopy of a clipping from the paper and a photo of the group, if you'd like to see, from August. And I think what's really amazing about this program was bringing youth and adults from Lakeview and North Lake together, which is something that we so infrequently do. And when we had the youth work in teams to develop the lessons, or to assist develop the lessons, we've had a youth from North Lake and a youth from Lakeview together doing that and paired. And so we had both of their perspectives, and so that's pretty exciting for us.
Jamie, to identify the barriers, are they doing a survey at the end of their class, or how do they?
So I have developed a survey that has been looked at through IRB at Oregon State University to make sure it's appropriate. Singh is going to work with his contacts as the schools to make sure that they also feel it's like low risk and minimal risk. And basically it is measuring what they've gained, measuring if they've made any behavior changes because of the education that they've received, but then also asking if they have went to see a healthcare provider or have an appointment scheduled, and if they have not, if they would share any barriers or reasons that they hadn't. So it's very minimally intrusive, and of course optional, but that's how we were trying to elicit the feedback from them.
Thank you, Jamie. Coming to the food core updates, Rochelle, could you give us the updates?
Sure. Yeah, I'd say pretty consistent since last meeting, but yeah, just continuing with those lessons that I'm teaching in various classes. Actually, just today I sent out kind of like a survey to administer or get some feedback from the teachers who I have been teaching for, and just kind of see how they think the lessons have been going, if they are satisfied with how they're connecting with education standards, and then if they want to continue lessons for the remainder of the school year, if they want to shift things around. So I'm interested to see what kind of feedback I get from that, and then adjust as needed. Our first taste test in the cafeteria at 80 Hay Fremont is going to be on January 10th, so I'm really excited about that. That'll be the first one, and then hopefully those will be going on monthly from there on, so we'll get about 6 in, hopefully.
What's the January vegetable?
It's carrots.
Carrots?
Yeah, so we're gonna get like 10 pounds of carrots, and I'm still kind of working through some recipes. I was thinking about maybe pickling, it could be interesting, or doing some kind of like carrot slaw or something or other like that, also carrot chips. So if anyone has any special favorite carrot recipes, please send them my way. Right, and then also getting in the process, I was meeting with Susan Warner today about getting these farm to school grant resources ordered. It's been a little bit slow going with that, but she's got me some good like resources that I can, or like catalogs and things that I can, try to get some hydroponic kits, try to get some terrarium set up, try to get compost containers, like little root view boxes, so things like that will hopefully be ordered, and then I'll be able to use those tools or help facilitate those tools getting used by other teachers in the classrooms at both 80 Hay Fremont and Union. Let's see. Yeah, I'm just working on getting a spring curriculum put together. So sort of in some planning stages at the moment before the holidays, just trying to get things all set to kind of like hit the ground running when I come back in January. think those are, yeah, the main updates thus far. We might be having some legislators coming, very tentatively, but yeah, we might have this program, legislators in the lunchroom. And so our local representatives would theoretically come for like a school visit, and get to see these kind of like farm to school programs in action, and then ideally be, you know, motivated to be supportive of us in, you know, back in Salem or whatever. So that might happen. Stay tuned. We'll see. Yeah. But yeah, I think that's it for me.
Thank you, Rochelle.
So, Rochelle, the recipes,
Yeah.
I don't know if that was a pretty big report that I sent you from when we did the study on the tasting tables in East County.
Yes. Okay.
People wouldn't make anything that had more than, I think, 3 or 4 ingredients.
We did mention this. Yeah.
It just, the parents, I mean, it was just,
Yeah.
it's gotta be simple.
Sure. Well, let alone, yeah, the fact that, I mean, the school has like, what, 90 cents per kid or something, yeah, crazy, like, few dollars to be spent on these school lunches, so, I mean, carrot chips, yeah, it could be 2 ingredients,
Right.
carrots and oil, so that could be a good option. But, yeah, that's a good point.
I will chime in. I'm hearing wonderful things from my buildings about Rochelle and the great job she's been doing, so well done.
Thank you.
Thank you.
Oh, no, I guess I was going to ask, I know that there is, as we're coming to about half your time here, because you will, your service ends in June?
July.
July,
Yeah.
okay. Are we examining, like, keeping this program, applying for, I forget how that worked, if we, when that decision will be made?
I think the decision will be made in, so we have a big meeting where the service members and the site supervisors are gonna, in February.
Okay.
And so there have been some changes in the legal part of how food court gets their funds, which they're gonna give us more information then.
Okay.
And yeah, I guess February, March is when we will, I would like to continue the program.
Okay.
And yeah, that's when we get more information about it.
Because I know as far as sustainability, before the school year ends, you know, having those connections and understanding if the program will continue or not will probably be vital to the success of the program for the next school year.
Yes.
Yeah.
Yeah, no, that's a really good point, Jamie. It definitely is sort of up in the air at the moment. But yeah, I think by March it has to be, the site has to reapply, and then myself would have to reapply.
Okay.
Coming to the grants, Christy has been feeling under the weather lately, and so she couldn't join us. I don't know all the grants that she's working on, but she is pretty busy every day. But however, we did attend Oregon Community Fund call last week, which was regarding the renewal grant for the dental screening. And I know Christy's working on a mental health first aid training program. She's working on how we could receive the funds grant for that. And the mental health first aid training program, it's an 8-hour course which will be taught to the police department or the school district staff. And the basic idea is to identify, understand and respond to signs of mental illness and substance abuse. And it also is in the strategic plan for the CHIP department. So yeah, and probably by the next CHIP meeting I'll get to know if we have applied for the grant or where we are with it.
Is that through UHLA?
I don't know really details on any of that. It's not an area I'm working on. I did attend a mental health first aid training in LeGrand on Tuesday with a bunch of their law enforcement, and it's a great training. I really enjoyed sitting through it, and I have a lot of awesome information.
So they have specific trainings for law enforcement, they have specific trainings for youth, so that's what the teachers are getting. Then there's just for the general population. The goal is to have 1 million people who have gone through this and equating it to CPR, that everybody should have kind of these basic skills to be able to help people in mental health crisis and get them to the appropriate source of care.
So next I'll come to the EOCCO incentive measures. Last week we had a meeting to.
Oh, I'm sorry, grants? Christy did get the older adult behavioral health initiative grant that she submitted.
The Obi grant.
Yes. I forget what it was, maybe about 11,000, 10,000, something like that. It was to,
Just shy of 12 grand.
yeah, it was to continue the gatekeepers program throughout the community, which is to train people who encounter older adults on a regular basis, store clerks, people like that, to make sure that they'll recognize it if there are signs of distress or need, to be able to get them to you, to get them to the proper resource. So that was successful. Sorry, but you know,
We're still on
thank you.
grants.
she nailed that one.
There's another grant that Christy and I and Rochelle and who else, I don't know, anyway, have been looking at that goes along with the food corps and the outdoor and the healthy food and the getting the kids involved in activities that are like that and hands-on. But we really, before we get even to go anywhere on that grant, we really need the community partners. And wow, there's a bunch of them in the room. The school district and OSU and let's see who else, for sure those two. It would be something that would go along with the food, it would support the food court thing and expand it. If you're interested at all and you have a chance before you leave, ask, and then maybe we will know, Christine will know if it's worth going ahead and trying to get in, because I think the grant would be out by May. So the deadline's like in January. So
Who was this with?
it's with, can we remember? Jim Wall sent us the link. It's, I wanna say the Oregon Community Foundation, but you just talked about that for the dental. So I think I'm confused a little bit. Community, I don't know, anyway, I'll send it to you if you're interested, but it's a one-time grant. You can go up to 3 years, they'll go up to $50,000, but what they want is something that has an impact. If they give the grant to you once, it has a longevity to it, a sustainability to it. So it can't be something that, you know, we're throwing money at and then it goes away and we don't have funding and whatever. And so in training all these other people through this other program that we've been looking at, we think that would have that. And then expanding the community gardens and some of these other things would, and then there's one more element that would have to do with possibly a little town element that maybe we could talk to the city about. And, because we wanted a way to draw in our seniors, so we'll call you. Somebody, Christy or me or somebody.
Thank you, Francie. Is there any other comment? So I'll go to the EOCCO incentive measure discussion. Last week we had a meeting to decide upon the incentive measures that Lake County wants to focus on. We decided on 3 measures that, if improved, we'll also improve some incentive measures with them. The 3 measures that we decided upon are effective contraception use, developmental screening, and diabetes and chronic illnesses. The idea was that if we improve the numbers of effective contraception use, we would also increase numbers for S-birth and timeliness of prenatal care. For developmental screening, increasing the numbers of developmental screening would also raise the numbers for the immunization rates. And for diabetes and chronic illnesses, it would also help with tobacco cessation numbers, which is also an incentive measure. If you look at the handouts that I have given out, we have the latest incentive measure percentages. The latest ones are the ones which are all in yellow, while the incentive measures with which we had the discussion was, is lower to that with some reds in it. So I guess it's, the numbers are slightly better than we had expected them to be.
I thought we talked about doing, did you say timeliness of prenatal care being one?
Yeah.
That was one of them?
So,
That one, developmental screening and chronic illness, diabetes.
so those are separate. So with the contraception use, we were gonna combine S-birth and prenatal care.
Okay, I thought that with the timeliness of prenatal care, we were gonna bring in contraception use and S-birth. So I got it backwards from what you're saying. Because we talked about with prenatal care,
No, you know what, I made a mistake. With the contraception use, the S-bird and the time, oh, you said timeliness of prenatal care should go with the developmental screenings?
no, I thought we were gonna focus on timeliness of prenatal care, and along with that, because they would do a S-word screening as part of prenatal care, and then at the end of prenatal care, they should be talking about effective contraceptive use at delivery, when that child's delivered. So I thought we were gonna focus on that one, but maybe I'm wrong.
No, I'm thinking the same.
Yeah, so,
I thought, Alana,
We
I
can-
thought you were the one that kind of thought that might be a good
Yeah,
idea.
I
Do you
think-
remember or not? I could be wrong, but.
I didn't write anything down, so
Okay.
I can't be positive, but
I don't know
that
for
does
sure
sound right to
they're
me.
saying, but I thought that's what.
we can make the change because we are still just discussing about it. Because there were some more changes which I was gonna speak about. So
Well,
we can do.
let's just think for 1 second here, right?
Yeah,
You have roughly 70 births in the county each year, right? Something like that, so that's 70 people. You have way more eligible females between the ages of 14 and 44 who need to have effective contraception as part of their strategy. So you can go either way, but you're getting a smaller number if you start with only those that are pregnant. And statewide, about 50% of all births are unintended, just in case you want to know.
That's anecdotal.
No, that's data from,
How else are you gonna determine if it's unintended?
you ask.
That's right. So that could be considered anecdotal, right?
Well, it's research based. If you go to that incentive measure, there's data there on births.
I guess one of the reasons why I wrote contraception was because that's one of the ones which we were in the red. Yeah, so I guess just for normal understanding, I combined and labeled them like that, but I'm sure we can make some changes to it.
You can deal with it in both settings.
Right, yeah.
You know, just,
And just to clarify, the two different like boxes again are the one in the middle, that's all yellow.
That's the new numbers.
The new, by new, is that 2000,
it's through November 30th of 2016,
from
from January 1.
January 1?
Well, what is the time evaluation period?
January to December 31.
Okay, so then the year before would have been 2015, is what you're saying?
No, I think of what happened there was, it was the October report, right? Because I just sent that to Christie.
Yeah.
She emailed me and said, you have new numbers, and I said, this is what I got. You guys saw November, or October at the last meeting. You had October at the phone
Yeah.
meeting, and this just came. So she prepared a new sheet for you, but it's not properly labeled. So the middle column, the yellow middle column is through November. The other ones were through October.
So it's just a 1 month
Yeah.
difference.
I guess
in
the
reported.
other one was through August.
The one with the application,
Yeah.
I'm sorry if I misspoke, but
Either way, we've got a lot of way to go.
yeah.
But there wasn't, so what we're seeing is there was a significant improvement though.
in a short amount of time.
in a short amount of
Well,
time.
the one with the application was through October.
Yeah, I guess those are again different numbers from the ones that are labeled in.
Yeah, but Charlie's right, you
So-
can pick any of them, and you still can improve.
We have significant, I mean, when we compare us to other counties, we have a lot of room to show how much better we can do.
So I was having a discussion with the clinical director at Lake Health District, and the reason for why the numbers have jumped so much in a very short time is because there was a delay in submitting claims to the EOCCO. So Juanita, the clinical director, already had the numbers which were very different from originally what I had sent out, the ones in the red. And yeah, so I guess they submitted the claims a bit late, and then
It's
the.
reporting timing, basically.
Yes.
Okay, all right.
Well, the other thing, and I met with Juanita, primary care wants to provide these services to all people, regardless of their insurance source. You want to provide effective contraceptive services to all people that are in. Her numbers were everybody. And so when I said, well, you have to break out to compare to these, just EOCCO people, she hadn't done that. So her numbers are gonna look better because it's for the whole population.
Yeah.
So that's what's happening too.
On these new numbers, it's the whole population.
No, these numbers are just
Oh,
the
okay.
EOCCO.
So we're making headway, just not enough.
Okay.
So do we wanna, again, decide on which three incentive measures, Lake County wants to focus on?
I think, because I agree with that, I think we went with prenatal as the top one
Okay.
at that time. That's my recollection, because contraceptive is targets you can meet today, but you have to keep meeting them every year. Prenatal, they can have a growing, it won't be as immediate, but they can have a larger expanse of benefit over time. That was my recollection of the discussion. But if we combine them, but what is, if 50% of the births in Oregon is unplanned, do you have it broken down to county?
I didn't see it in the
It would be across the board.
incentive measure. If you click and go to the Oregon Health Authority and look at each one of these, there's a whole evidence-based information behind it. That's where I read that about half of all births are unintended.
I doubt it would vary much from county to county. I think that's a pretty standard statistic, probably even nationally.
But the effective prenatal care leads to a higher birth weight infant. Lower birth weight infants can, if you have a neonatal intensive care visit, it can be hundreds of thousands of dollars. So it's a good investment, prenatal care is.
Jill Harlan was saying that we have a high rate of smoking, pregnant women who are still smoking. Might cut down, but they're still smoking. So that would be a good place for us to look at that.
Either one would be good, so depending what the group thinks is. I think one of the things we talked about too was that, instead of picking one that were in the red, maybe we should pick one we're close to actually meeting and try to meet.
Yeah.
Something, play the numbers a little bit and see if, I don't know, if it makes a big difference.
Paul, I'm guessing with the new November numbers that we are probably in the yellow then? We don't
They're all
have
in
any.
the yellow.
Well, actually, this shouldn't be a percent.
Oh.
The ED utilization, you're meeting the measure. Lower's better there.
Yeah.
So that should be a green one.
So when you think about it, with the exception of the dental sealant program, we're 50% of target in all. So no matter which one we focus on, if we can improve ourselves by 50, well, lots of improvements, so it really doesn't make much difference. The dental sealant, really what we're planning for is next year, 2007. Because impacting it this year is not gonna make any difference. We got 14 days left of the year.
And it runs on calendar year?
That's what Paul was saying, is the time period is the calendar year,
Yeah.
so.
How many more of those sheets? 'Cause we don't-
Yeah.
Oh, that's what he's got. You got one?
Yeah.
Thanks.
Thank you.
Well, we're looking at the thing that we think is, that we need to do most, and then you looked at a bunch of different things that you thought would actually kind of piggyback on that if we did and made a significant change on whatever that choice was. And now, because we're low on a lot of things, we're not sure yet what we're gonna do. How do we figure out what thing we're going to do then? Because we have to decide what things are most important to our community and focus on them and go for them. Some of us met last week to look at ideas of how we could look at that and get some numbers for you, but we need this group to make the decision
What
on
what
what
do
you
the
wanna do.
doctors think? What does the medical staff think? Because they're gonna be implementing a lot of this.
So I had a meeting with the clinical director after we met, and so we have some idea about where we wanna invest the funds. So when I met with Juanita, with her, I started the discussion. So again, we don't know which incentive measures we wanna look at, but we have an idea about which groups of incentive measures we wanna work on. Like, for example, we're definitely gonna work on S-birth, contraception, and prenatal care. And to that, I again wanted to ask you if we take prenatal care as our incentive measure, can we piggyback the contraception use and S-birth with them?
I think so.
Yeah, because I guess the last meeting, last week we had, the idea was, we just choose one of the incentive measures, but we'll take along the other ones which we think will improve with them. So when I met with Juanita, so I discussed S-birth, contraception use and prenatal care, and I was like, because the next step with the incentive measure is that we need to put a dollar amount to the incentive measure when we make our proposal. So Juanita said, for the contraception use, what came to her mind was we could do staff trainings. And the reason for staff trainings is because she said when it comes to S-birth or contraception use, we have this idea of we can ask this one key question, but again, because it's a sensitive topic, some of the staff faces difficulty with spreading the awareness, and they were like, if some trainings can be done, they could handle it better. And her second idea was to purchase some equipment like tablets, for example, iPads. She thought that would really help out the clinic a lot. That'll be very efficient and also save a lot of time. Her idea was, presently what the system is in the clinics is they have a lot of paperwork, and after the patients are seen, either if you wanna make them fill a survey or some kind of a claims form, or we want to spread some awareness through a survey, normally what they do is they hand the paper to them, and our medical assistants in Lake Health are very busy, so then they have to come back and take the paper back from them, and then they have to enter the information into the system either by filing the paper or manually putting the information into the computer. She thought if each care team has an iPad, and for Lake Health we will require 4, she said. I still have to discuss with other clinics like Lapine and Warner Mountain, and I'll do that and I'll keep you guys posted. So for Lake Health, what Juanita said was she needed around 4 iPads, and how that would help is once the procedure is done or the treatment or the checkup is done, they just hand the iPad to the patient and they can digitally fill the form and press of a button, the information will be entered into the system. And she thought iPad could also, because there are these apps for sensitive topics, she thought even iPad, instead of the MA going through asking the sensitive questions, the iPad can just help them with that.
I'll bet they even have like little advertisement information thing, not advertisement, information that comes up on there that's inserted in there, or if it isn't, there should be. Because that would be awesome, if they were to have, some of the things that the facts that were like, this is important for them to get, and there was a way that when they're filling that out, those were designed to come up. Then, you know, instead of handing them something and not knowing, it's like built in that they see it right there.
Yeah, exactly, and also with the paperwork, it seems that many forms are just due to human error. We don't end up entering the data, or all the forms are not properly like kept in file, and so she thought staff training and iPads would be helpful for improving the numbers for effective contraception use. And for prenatal care, she said that she's working with Dr. Graham and they are working on getting a portable ultrasonic unit. And I guess the cost for the ultrasonic unit is gonna be way more than the 32,000, 33,000 we're gonna be offered, but a small amount could help with getting a portable ultrasonic machine. Again, these are just ideas that she was throwing at me, and we need to decide if anything sticks.
You guys have ultrasound already, right? In imaging, yeah.
I guess the idea was for portable because they would go to people who can't access the hospital. Yeah, so it was a portable ultrasonic machine.
Okay. The tech goes with it though. So on the iPads, this is a move that many primary care practices are doing. But it is, they're answering the screening tools is what they're doing. It's not a place where you should really get information.
No?
No, because
Okay.
someone needs to interpret that score. If you did the PHQ-2, which is a depression screening, and you answered yes to either one of those, then the other 7 questions are gonna come up, and the people would need to move through it. The SBIRT is actually a screening tool as well. Any number of things, I mean, that saves paper and time. You know, they have indicated that young people answer computer questions more honestly than they do if it's a verbal request. Older people are gonna fight the technology, I can tell you that right now.
But since we're looking at contraceptive,
Predominantly younger people.
Yeah.
Focus.
exactly, yeah.
I guess I don't understand what the point of a tablet is for I mean, the best way you're gonna get people on effective contraception is you ask them the question and you get them hooked up now. You don't do a screening and then you figure it out and then you have them make another appointment, and then you have them come back and make sure that's what they want, or now we have to order the device you wanted. And now you're 2 or 3 appointments in and I can tell you they're gonna bail on the whole thing, they aren't gonna come back. If you ask the question, you wanna be pregnant in a year, no, I don't, okay, here's, according to your health history, here's what you can do for birth control, which one do you wanna leave with today? And that person leaves with that thing today. That's how you're gonna do it, if you can give them all the questions in the world and it doesn't, it's not gonna matter.
Right, but that could be one of the questions of many that you're asking patients to do on that initial visit. They could be filling out the SBIRT, a depression screen, answering one key question, you know.
But then is that information available immediately to that physician so that when that
It should be-
physician
it should
walks
go
in the room
right-
with that patient, they have that answer?
It should go right from the iPad to the electronic record. There's no data entry or any of that. I mean, that's what she's looking for, right? Yeah.
That's what the idea was, but yeah.
Yeah, I mean, the clinician would have to review that screen. I mean, just screening people is not enough. There's more to it. But if they don't act on it, why'd you ask the question?
Yeah.
That's-
Well, yeah,
that's the
and-
real-
or if I have
that's
to
the real
schedule
one.
again, but then the other thing is that if they're there for a sore throat and you're asking these screening questions, does the doctor have time to deal with that yes answer? Yeah, I want effective contraception and I want an IUD and it needs to be placed today. How, you know, it's almost like you have to reroute them to a specialty clinic then, or something. Because the primary care doctors aren't gonna have time to deal with that, they didn't schedule time for that. but that's, honestly, if you wanna see those numbers come up, that's what you need, especially for that OHP crowd. It's, they're here now and they want it, you better give it to them right now.
So what that really means is, if we're going to start asking the question, we need to be prepared to respond
Yeah.
right then.
Right, refer for depression,
And
refer for alcohol or drugs, or
whichever,
Yeah.
so that we need to have our team coordinated, which is really a big part of it. And maybe that might be something as we describe it, if we're asking to get some money, that we focus more, less on tools and more on process. I think personally we ought to really focus not only on that, but also on the colorectal screen. I think that has a significantly greater impact on a different component of the EOCCO population. And even though it's not had much success anywhere, somehow we've got to figure out a better way of doing this.
In the past, we've received funding or applied for grants to improve the numbers for adolescent well care visits, dental sealants, and the screening, correct? Those are the three areas?
We haven't for the colorectal.
Okay, that was just a different, it was a program though that was offered, but it
There was some
wasn't.
stuff, we really
Okay.
didn't push it hard.
that was using 2013 dollars, Jamie.
Okay, okay.
But yeah, we did.
And we didn't do a real heavy, we sent out stuff, but it didn't really work.
Right.
So we know that mailing packets to people doesn't have a significant impact.
Lake County didn't mail them, they had to be hand delivered. Our packets were hand delivered.
Well, the fit kits came from the senior centers, but there was a letter that went
There
to
was
all
a
eligible
mailing
people
that went
saying,
out with the
then you gotta
information,
go
yeah.
here to pick up the kit, to do the fecal test. But there is the other grant that your clinic could apply for, the up to 25 grand, where they centralize mailing service with follow-up and phone call. That's, you could apply for that. I don't know I think we talked about that on the phone.
Yeah, so the last meeting we had spoken about colorectal cancer screening, and the idea was we will try to use the funds in the other selected incentive measures, and if we have remaining funds, we can use it for colorectal or adolescent, or otherwise we have these opt-in grants, but they are competitive.
Yes.
So, yeah, so that is what was decided in the last meeting.
Does the general public have educated knowledge about colorectal cancer?
It just sounds something you don't want to talk about, right?
Yeah.
I mean, it just does not have, whatever it is, I don't want to talk about it. When you say the words, colorectal. Right?
How about just changing the word to intestinal?
We gotta do something, we have to figure out a better solution, whatever it is, it is.
How could the general populace out there would have to say, I know about this subject, and I'm subjected to it, I want to do something. Whatever names apply to it, but you have to get the persons out on the street wanting to be knowledgeable about it and willing to do something. Otherwise, you give a kid and say, put some poop in a sentence, or toss it before they get home.
I'm not messing with that.
I go back to education, education, education. People need to have knowledge before they act on anything, their willingness to act.
Decide upon.
Okay, so let's get some options and vote.
Well, it seems like last time they avoided, maybe for the same reason of what you said, Charlie, but the colorectal, because everybody was coming up with ideas of what they thought they might be able to do for different things, and they didn't think they had like a really, for lack of a sexy, for a really cool idea for that particular one. And they're like, hey, what can we do the biggest bang for our buck? And that's why they started grouping them. And that doesn't mean we have to stay with grouping them. We pretty much decided on diabetes because it's not gonna cost us very much and we can, but there's not a big dollar amount for that for us because of the partnership with, Clarence County and so now we just have to decide what you're really passionate about and what you really think we can do so that we can fill in the money.
We have to have people willing to implement the strategies, I guess, at this point. I mean,
Just for clarity, for the people who may not have been on the call, Francie, the organization in Klamath County is the seniors? Is that who has the living well?
Sky Lakes, they have a search grant.
Okay,
Sky Lakes
Sky
Medical.
Lakes has the Stanford-based Living Well with Chronic Illness program. And that's what we would talk about bringing in and having people with diabetes and hypertension, so it's really two of those measures referred to those classes. Jamie's had some experience with it overall. It's a great class. Problem is getting people to go to it. So what I was suggesting was a little incentive if you made 5 of the 6 classes.
Yeah, and when we played around with numbers, we were able to put that in there. That gave us a starting point for, we gotta be able to put some numbers to some of these different things. And if the first meeting, a lot of the things that everybody came up with were things that had to do with improving the reporting or improving some kind of something in the clinical process. And we're like, well, wait a minute, we could do better on that, but that doesn't give us a dollar figure to fix it. What can we do that has, we have to start figuring out how we're gonna apply those dollars and be effective with.
So we have to think about the dollar amount and the process by
Absolutely.
which we will execute the. So for colorectal cancer screening, we plan to give out these kits. That's the only process that we have in mind.
That's what was done
before.
in the past, was that they had to call and request one, but they had to actually physically, and I wasn't a part of it when it was set up, but they had to physically either come into the senior center and take one, or when I went to North Lake County, I took them out, but again, they had to physically come take them. And they did not want to talk to me about them at all, honestly. They didn't, not just to me, they didn't wanna talk about it at all. And I think honestly, kind of what Charlie was saying, if they were, being mailed out, that might have actually been a little more effective. They don't have to put their name on anything, they don't, but you're gonna mail out, 500 of them and probably get 30 of them back.
But didn't you do that to some of them? Didn't you guys have figures on that last time that you did some of that and didn't get it back, or somebody did?
Lake County didn't have a good
There was like
response.
one return to
Yeah.
that.
But they weren't sent out, they were.
Yeah, what needs to happen is that the kit needs to be sent out. It needs to come not from a community group, but from their clinician with their clinic letterhead and their doctor's name on it. There needs to be a follow-up call from the MA answering questions, and then the uptake on it's much better. But to just send it out doesn't work, we know that. There has to be a follow-up effort.
And it sounds like it has to be a follow-up from the clinic, so we would have to make sure that they're on board in order to implement that.
Right, well, what this opt-in thing is it's a third party that would say, I'm calling on behalf of the Lake Health Clinic.
Yeah.
Did you get the kit? Yes, do you have questions? But it would be, the kit would have been come out with their letterhead, their doctor's name.
Okay.
And change the name. From colorectal to intestine, something.
Intestinal cancer screening.
Go ahead.
Yeah. Make it more palatable.
It's not really your intestine.
Well,
I think you.
the American Cancer Society.
Yeah, it's not really your intestines, your intestine. It's a whole different part, yeah. Well, because then they would send a kit out, and it would say you're clear, and then watch, they get intestinal cancer, and then, you know, I mean, you can't be like saying it's the heart if it's your knee. It's not
Say
gonna
the
work.
lowermost part of the intestine.
Your rear engine cancer check. Doesn't sound so scary.
So, and I also have to advocate for looking at the effective contraceptive use, because with our percentage being so low, that being something we haven't targeted in the past, and coupled with the 50% of pregnancies are unwanted, or unplanned, not unwanted, that was unintended, that it seems like something that it's time to address, and something that we haven't addressed or we put money towards, in the past.
I think it's good only because we have that problem with the low birth weight. Those kids were probably not intended, you know, and I think, you know, when you have children that you're not gonna take care of.
It was unplanned, yeah.
For the developmental screenings and the immunization rates, when I spoke to the clinical director, she said that we already have a system in place. That is the idea with the public health department, sending the ASQs, and so the system is in place, but they haven't put it to effect yet. And she was optimistic that once the system starts to work, the numbers will go up. And so that was that. And coming to diabetes and chronic illnesses, again, as Francie said, we are already working on one program, the Living Well program with Sky Lakes, and I've been in communication with them this week, and Francie herself is can be the certified facilitator we need to for county, and
Since Noni is available,
yeah, definitely we can.
as she was leaving.
But who did you have before? Or were you certified for it before?
Not the diabetes, but the chronic conditions, and
Oh.
yeah, I definitely have lapsed since,
Yeah.
the late 2000s, yeah.
I missed something. Did you also mention the National Diabetes Prevention Program? Is that what you said?
No, we are talking about the consent, you're talking about the Sky Lakes?
What were you talking about, Jamie?
Chronic conditions.
She'd done it before.
Living well with
Living-
chronic
yeah.
illness.
Yeah.
Okay. I mean, the other one is that National Diabetes Prevention Program. Medicare is gonna begin to pay for that in January.
No, we didn't discuss that. We are talking about the Living Well, and it's also reducing smoking.
Okay.
So we thought that will again touch on the other incentive measure of tobacco cessation. So that's one of the ideas we had for diabetes and chronic illnesses. Then, and also for tobacco cessation, Juanita said that we could also buy these, we get these lung kits, which show you a normal person's lung and a lung which is, if you have smoked a lot and you can touch it, you can feel the texture, and that goes again for kits of placenta. If a pregnant mom is in a smoking household versus a pregnant mom who is not in a smoking household, there's a significant difference. And so she said in the clinic she was working in previously, they had these kits. They would also rent these kits out to school and other awareness programs, and for her it was very effective. So that was one other thing the idea she had about we could purchase these kits.
That'd be good.
And then talking about the health fair. So I and Christy got in touch with Baker County. They have a very successful health fair, annual health fair that they conduct just before the new school year starts. And so we could replicate that model, because we even had the numbers and it was very successful for them. And for the reminders or advertising for the fair, what Baker County does is, so the school district mails out these packets to the new students for the new year, and the clinic included their flyer with the packet. And also they did some reminders before that. And in the health fair you can have these stalls. So adolescent welfare visits, immunizations, dental sealants, and even more, we can plan and you can have these stalls and, yeah, I think only for like from 5 PM to 7 PM they did it, and there's a very good, they screen many people and the numbers are really good. And that's where a significant amount of our funding can go into.
Why wouldn't you do that as an opt-in?
So we can definitely do opt-in too. First, I was thinking the idea was to exhaust the $30,000 and then go for the opt-ins, because opt-ins are again competitive, right? There's a chance we won't get them.
True.
Yeah, but we'll still go with them.
But right now, we don't have enough spent out of the 30,000 yet to say, no, we can't do this fair that everybody thinks could be very successful here. Because I remember at the meeting, there was like, wait, you got this money that's competitive, you could go for that. But when we started to try to put dollar figures to these different things, we're like, why can't we do the fair out of some of this money? So if it's possible, we just thought maybe we should try to go for it, and that's when they checked out with Baker to see what it would really cost.
Okay, and I shared with the group on the Friday call that the evaluators at OHSU would rather see you do a couple of things really well
Understood?
than
Yeah.
spread it out
Yeah.
and not
I
have
agree.
enough money going to each of the things. I mean, 32 grants is not a lot of money, folks. Do something right.
Did they say how much that health fair cost when Christie and you talked to Baker County?
No, we need to get the data on that.
Well, they're budgeting for up to 50,000 for that event. But you're also paying for all those clinicians to be there, you've gotta
Oh, I
have
see.
that there, somebody's
not
gotta
in kind,
agree
yeah.
to bill, you know. Well, they had some in-kind stuff, but they're recognizing you're not gonna get everybody to go there and just be nice. You know, you're generating an encounter with a member of the, you know, it's a medical visit. So they're gonna need to be.
And we did figure that, we did start to look at that and say, wait a minute, we can't ask these people to do it, so, yeah, that was a line item that we realized, yeah.
So we could use the opt-in grant option for colorectal and the health fair. And then what do we want to use of the $30,000? So now I've said everything I had about the incentive measures, and now we can decide on.
I think what our vendor needs is, they need agreement from this group on what areas you want to see prioritized, so that he and Christie can begin to put together the proposals.
Well, I think
Start.
effective contraceptive use is good, developmental screening, and diabetes and chronic illness. I like those three.
Those were the first three we mentioned, right?
Yeah.
Okay.
I like those three.
Well, and that's, I guess, kind of the hard part, is we had like a 3-hour meeting last week, and those are the things we came up with, right?
Yeah.
And so I think to honor people's time who were there, and most of the people around this table, it kind of seems like, why are we rehashing this? If I can be honest,
Because that wasn't the full committee,
okay.
that's the only reason why.
The full community was invited though, correct?
That's true.
Yeah.
Okay, all right.
Now we have the committee meeting,
Yeah.
now let's vote on it. And I think there was a lot of hard work done, a lot of discussion.
That committee last week, you guys actually had a recommendation for it.
Those were the
Not
three.
as a fault of the meeting, so
Say go through, yeah,
Contraception,
developmental
developmental,
and wellness and diabetes.
and diabetes.
That's a clinical measure, Ken, comes out of the medical record, control of diabetes.
Well,
So can we make a motion? Can I make a motion to approve the
it's just gonna
three
call for a
as
motion.
submitted that you guys worked on last week? Look for a motion.
And I'll second.
So it's been moved and seconded that we have Arthur and Christie work to apply to the CCO for monies to focus on the effective contraception, the developmental screening, and the diabetes chronic condition issue. All in favor, or any other discussion? All in favor, please signify by saying aye. Aye. All opposed, same sign. Motion passes. Thank you.
Get to work.
And if we use just the word colon cancer,
Still on
it'd be
the
a lot more
colon cancer.
palatable. And you have to go through the other part to get there anyway, so it's covered.
Thank you, Ken. That's very helpful. We appreciate that.
So have you all decided on conducting a health fair?
We have a health fair every year at the Daily Days. That's something we've done. We might be able to combine the Daily Days with some of the health fair that Baker County did, something similar.
But are they gonna have that registration piece ready in
Yes.
June?
That was part of what made it successful, was a
It
registration.
was right
piece and
before
the giveaways
school,
for
and it went out
registration.
with the registration packets, and the kids came in, and they moved through the sections without parents, most of them, is what I remember hearing.
Showed up at the park.
Yeah, they showed up at the park, and so it was more geared towards school. I don't know if we can change the date of Dr. Daily Days to coincide with that, but I don't know that they'll have, Will can probably tell you that, they don't have that stuff ready by June, do they?
But you know, before you answer that,
No.
one of the things that we have done here is our physicals for sports occurs in the spring.
Yeah.
It doesn't occur in the fall. So maybe we could focus, when typically, do you recall about when that pre-physical gets done for sports?
Usually May,
In the month of May?
yeah.
Is that the
Which
same
is-
for North Lake, I'm wondering?
That's a good question, I don't know that.
Usually
But you
that's
know, if we-
second week in May usually.
If we can do that, and Daily Days is fairly close to it, if we can maybe get something close to either having two or having one specific around that, we might be able to, because, number one, you get all the kids that are doing sports. And then you can get all the kids that might be able to say, well, you may not be doing sports, but be a
Come on
great time
in.
to connect you
Yeah.
to anyway. And everybody wants to be near, I mean, so you could create a little bit of synergy around it. And it does the same kind of thing as the Baker program.
And do we have,
What do you think?
I would just put have a day and, have it on Honker Court and,
Yeah.
then, have the classes rotate through and partake in it, so set up a schedule.
do you have kindergarten roundup?
Oh, yes,
Okay.
every day,
In the summertime.
Every
But
day?
we were
every
trying
May,
to,
Oh, every May?
yeah.
we were trying to affect adolescents here.
Yeah, I know.
So-
It just came to,
So the
like,
thing with Baker that made the difference was all the doctors, the St. Luke's doctors and the St. Alphonsus doctors, so the Holy Wars, they all agreed, we're not doing sports physicals. We're doing adolescent well visits, and then we'll sign off on the OSAA required sports physical, but we're not just gonna do a sport, that's the difference.
yeah, that was
You've
it.
gotta get a commitment from the people who are doing the screenings.
Mhm.
Cause there'll be a little pushback on that one.
Let's talk, I think we can put something together.
And once again, when does the Daily Days fair take place?
It's always like about the third week of June, second or
It's in
third week
June.
of June. It's like after all the kids are out of school, so.
So can you get them to, can you make a policy that says we want not just sports physicals, we want these other, the wellness child, the teen child?
Well, I'll tell you, the sports physicals have always been Bobby Stenger's baby, and that's the person I have to,
Oh, okay.
That's an,
Big
So you know who
that's
we're
a,
talking
that's an OS, Oregon Scholastic Sports Association issue,
Oh.
not a local.
yeah.
Hmm.
So basically Bobby will be my main point of contact, and I'd have to have this really, intense discussion with her, so.
The other issue with that sports physical is good for 2 years. We're supposed to have annual wellness visits, so that's part of it as well.
But at least get the first year in.
Yep.
Let's meet, I can get Bobby there, and pick a time, and we can start talking about all this.
You're on that way.
So before this meeting, we had decided upon the funds that we wanted to use up. We thought the funds will get used up in the advertising, media, the incentives we plan to offer for the various incentive measures. And kits, again, if we wanna go ahead with getting some kits. And then staff training, equipment, which I don't know if that will apply now, but we discuss more about that. And the health fair. Does anybody have any other comments or where we could start focusing on, where the dollar will be used up?
We're not getting kits with this money though, because we just said that we're doing 3 things with it,
Yeah,
right? So we're not doing the colorectal screening with this money.
yeah, but the kits were also for the diabetes and, but it was just an idea, because with the diabetes, we were planning to also work on the tobacco cessation one. But we can definitely just remove the kit,
Kit, I don't know what kits you're talking about.
the lung kit.
Oh,
Oh,
those,
the
the
educational
presentational kit, yeah.
Yeah, my bad, not the colorectal.
Oh, okay, I thought you meant it was a screening kit.
No. Okay. And we could look at that, I can also look and see how expensive they are and see if I have funds in that and something else, just in case.
Are there other areas that somebody thinks where the funds would be used up?
I would just suggest, as you're putting it together, if people are expected to do something, pay them. Then it'll get done.
Yeah, that's where
And
we,
it won't take long to spend 32 grand.
so we kept a separate category for incentives, because we know that we have to provide incentives for people to show up.
Right.
So,
Well, I meant people
Yeah, he's talking about
around
the
the
doctor.
table too.
Yeah, yeah, you can't be voluntold to do something, you
Doesn't
need
work.
to actually be, yeah.
Because we would have to probably pay,
I mean,
I'm
that-
not sure how the
To actually,
sports things work,
yeah,
but
there would need to be a position of somebody's time, an FTE dedicated to organizing that whole thing. And just to give you an idea, this year it will be $11.2 million will be withheld from the CCO to meet the incentive measures. We have to get 14 of 18, so each incentive of the 14 is worth $800,000. So it's worth it to do something right to get that money back. We missed colon cancer by 10 people last year.
Now it's 800,000.
Our vendor and Ken are gonna see a new report that you're gonna get monthly that actually breaks down these incentive measures by how many actual people need to get that service. So that'll be, they're looking for input from, all the people at the regional community advisory council meeting on this format. But I think it's really effective. When you see, hey, if we just got 20 more people to do this, we'd meet the measure.
We got 10 people around the table, you guys are all up for this, right? What
well,
did
you have to be
review?
on OHP, correct? To
Yeah,
make
I
it
mean,
count,
right,
yeah.
yeah.
I'm just joking.
Well, we work at the hospital, we can find all the OHP patients and go and do it and send it in.
So a thing like colon screening. You got a positive test, I mean, you don't have it. It's 10 years before you need to do it again.
Only on a colonoscopy. If you use the FIT test, the fecal blood test, you need to do it every year.
Yeah. But let's say person X go in and have him or herself test, he's not gonna be concerned about it for another 2 years. So how can we count that?
Well, they're counting,
For each year?
yes.
They mine the records at a doctor's office?
They do. That's a chart review. That's how the state does that. They get a random sampling of our patient names and then they go in and look through the chart review.
We'll have to pay these doctors to do this stuff too, so that's gonna be a big chunk of money. I don't know that they'll
Well, we can
voluntarily
talk
do
to
it.
Charlie about that too, like I mean, if they're going out to the health fair, their time needs to be compensated. But they're also rewarded by the EOCCO for being a patient-centered primary care home and for the meeting the quality measures. They get paid
Yeah, that's true.
for doing this, so. I mean, there's some that could be going there, but it should, they're,
It's right.
Okay, good. So you can see shit, because the doctors, there goes your budget. 2 hours and 3 hours, yeah.
Is there any other discussion you want to do? So I'll try to come up with a rough dollar amount for the incentive measures that we have decided upon, and I'll keep you all posted before the end of next week. Do that, and then I'm guessing there'll be more changes that we require.
What is that grant application due?
January 12th.
Identify the process and that will dictate it from.
Yeah.
So it may be that at our January meeting, you're fine tuning the budget
yeah.
and deciding what you can or can't do.
And that's why we have to have
But
meetings
we have-
before the end of that January meeting, because we have to have everything done by then, folks?
Yeah, I don't know what the date was for the next one, I remember.
It's this, I think it's January 8th or 10th, the second Thursday.
Okay. So there's time to make an adjustment after that.
Okay.
Yeah, but the plan was that we have a solid idea of what we want to do by the next chip meeting.
The second Thursday's the 12th of January.
It's the 12th.
I guess the meeting is adjourned.
Okay.
January.
All right,
Thank you.
thanks.